We're going to switch gears now. We have the winning video for free LASIK. Denver's most renowned LASIK surgeon, Dr. John Dishler, has been on the show as an expert. We talk about LASIK surgery. And I have to tell you that this morning, we get to meet the man who won the serious category video. Now, we had two submissions, or two categories of submission, Dr. Dishler. People who were going to be funny and people who were going to be serious, right?
Right.
And each one of them would win a free LASIK surgery.
That's correct.
Now, Levi won the serious category. You haven't had your surgery yet. That's why you have glasses. Are you nervous about it?
A little bit.
A little bit. Everyone's a little bit nervous. I mean, it's natural to be a little bit nervous. Have you visited the facility?
I have.
What do you think about it?
My consultation, and it's amazing.
They're so nice.
Yeah, the technology involved with it nowadays it takes away the whole nervousness.
All right, let's take a look.
Yeah, this is what's great. I mean, we've had other people on who've had the LASIK already saying, hey, it's great. I can see
Let's follow him through.
But yeah, this is someone who hasn't had it. He won the contest. We have video of his submission, also a little video of when they told him he won, which hopefully we can show. And then he's going to be filmed on Wednesday, next Wednesday's when we're doing his surgery. And then he's going to be back to be with us again afterwards. So,
all right. Yeah. So let's take a look at his winning, or at least an excerpt from his winning video. La 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 la
one step at a time, don't be living on the line. I don't need a friend, I got more than on the mind. Sunshine in my brain, making everyone complain. Radio in the heart, don't be being so strange. Think I'm losing it, baby, where have you been? Everybody says that you're moving again. I don't wanna be right, baby.
If I told you that you won the contest, would you be excited?
Yeah.
Yeah? Congratulations. You did.
Take a bow, take a bow.
Thank you guys.
Congratulations.
I'm gonna go outside and scream.
What a great value, Levi, and these people are really good. You're gonna love them. And how bad are your eyes?
Pretty bad. Yeah, without them, I can't see faces. I can't distinguish, if you're looking at me or not. And so
we're gonna follow you through.
Awesome.
Now, Dr. Dishler offered two of these for the serious category. Yours was kind of funny, not that serious, but you got the serious category, and then we have the funny category. Let's talk about the latest and the greatest. Of course, you pride yourself at having a state-certified surgical center. Explain what that is, because I think Levi would be more comforted to know that you control everything.
Right. This is like a small hospital, so we have complete control on the environment, backup generators, backup battery power for everything. We have our own air conditioning, filter the air. We have to meet all the guidelines of a hospital. So
it's a day surgery center.
It's a day surgery center. People could have more major surgery than this there, but we take it very seriously. Knock on glass, I guess. We've never had an infection. We have all registered nurses. We're prepared for, anything that might happen. Someone has an allergic reaction, for instance, to something. We're, prepared and ready for that, as opposed to just a LASIK center that's opened in, you can open a LASIK center anywhere, but we do this in our certified surgery center. Our total facility is almost 7,000 square feet, so it's fairly large between the office part and just adjoining at our surgery
And you
part.
have your own air supply, actually.
Yes, we have a double filtration thing for the air. We control the temperature. One of the things for getting really good results is having very consistent temperature, very consistent environmental conditions. We have 2 operating suites. We have 4 lasers all together. We do only blade-free LASIK. So we're very, we think, state-of-the-art.
Let's talk about the surgery itself and the laser machines, or the lasers. Talk about royalties. I don't think people understand. When you own your own laser, it still costs to turn it on. Now, the reason I'm bringing this up is because it would be impossible with the latest technology to charge $200. Because some people do this ad, $200, $400, and we have to tell them that the newer lasers just to turn them on could cost that much. Explain what a royalty is.
Well, there's two parts to this. First of all, the ads that say as low as $2.99 or $4.99, it's only a very tiny percentage of people that qualify for that. That's sort of a come-on. They couldn't make money doing everyone for that price. Secondly, you're right. The lasers, there are older lasers that are still approved, but you wouldn't want to have your LASIK with them where there are no royalties. But all the newer, better lasers, and there's a number of them,
yes,
they require, besides once you buy the laser and own it, which is very expensive, it's like a vending machine. You have to pay every single time you use it. So when someone has a laser treatment, we actually are doing 4 laser procedures. And each procedure, 2 to make the flaps and 2 for the correction, and each one requires payment of a royalty that are cost hundreds of dollars a piece. So it's very, very expensive, just the costs of doing this.
Exactly. You know, there is no magic, people. You know, less than 2% of the people actually have little enough correction that they can do it for that cheap. You know. Now, let's talk about active lifestyle. That's another question we get, okay? What can I do? What can't I do? Am I going to be limited?
You know, most people that have this done, they can see well, although a little bit blurry, but very well right after it's done. Next week, you'll probably hear this for yourself. I expect Levi will be able to read a clock across the room without his glasses, which you can't do now. By the next day, almost everyone can drive themselves in for their post-op appointment, then go back to their normal activities. We have a few restrictions. We don't want people skydiving and doing certain things, you know, for a couple of weeks. But most people, if they have it done within a day or two, they're back at work, back at their normal activities.
And of course, for you do have an active lifestyle, Levi, right?
And no paintball, you know, for a week
no, I
or
mean,
so.
Think about that. You won't have to worry about glasses. What do you? Because glasses are a pain.
It's exciting. It's exciting. I used to ride a motorcycle for a couple of years, and having to put my glasses on under my helmet and fuss with that every single time. You know, it's going to be a change. It's going to be an awesome change, and I'm excited to. Definitely.
And are you a professional paintball referee? What, are you kidding me?
Actually, something like that.
What is a referee? I thought when you get hit, you know it.
Yeah, a ref is someone who works at the paintball field and refs the games for.
All right. So glasses are getting in the way. We're going to follow him through next week.
Next week we'll have footage. We're going to, you'll get to see what it's like, and I think that's going to really be helpful. You know, the more people know. One of the things I want to mention is everyone who comes to see us, we give them a tour. They not only get an eye exam, but we give them a tour of the whole facility.
And that's no obligation and no cost.
No obligation, free. And then by seeing the operating rooms, by meeting everyone, by getting a feeling for what it is, it really takes the the nervousness out of this.
And by the way, you get a free iPod if you're a candidate. Remember that, a free iPod if you're a candidate just for showing up. And there is no charge for the exam, a thorough exam, and no charge for the tour, of course. And they want to answer all of your questions, plus 24 months, a 0% financing with approved credit. Some restrictions apply. Of course, you have to ask them for details. You can go to Dishler.com to find out more. Dishler.com. Or give them a call, 303-793-3000, 303-793-3000. This is the place we recommend to our friends and family. I mean, Paula's mom. Paula's mom went there. Dishler.com, 303-793-3000.